these stories aren't new. You know, these stories are happening all over this country, not just for thousands of women, for millions of them. For 2 years on the campaign trail, this was what I heard from women, that they were being crushed by the current structure of our health care. Crushed. This is why we are fighting so hard for health insurance reform. This is it. This is the face of the fight. When it comes to health care, as the Secretary said, as we all know, women play a unique and increasingly significant role in our families. We know the pain because we are usually the ones dealing with it. I will never forget the time 8 years ago when Sasha was 4 months that she would not stop crying. And she was not a crier, so we knew something was wrong. So we fortunately were able to take her to our pediatrician that next morning. He examined her and said something's wrong. We didn't know what, but he told us that she could have meningitis. So we were terrified. He said, get to the emergency room right away. And fortunately for us, things worked out. Because she is now the Sasha that we all know and love today, who is causing me great excitement. But it is that moment in our lives that flashes through my head every time we engage in this health insurance conversation. It's that moment in my life, because I think about what on earth would we have done if we had not had insurance. But let's be clear, women aren't just disproportionately affected by this issue because of the roles that we play in families. Women are affected because of the jobs that we do in this economy. We all know that women are more likely to work part-time or to work in small companies or businesses that don't provide any insurance at all. In many states, insurance companies can still discriminate because of gender. See, and the thing that we all know is that the current state, this current situation is unacceptable. It is unacceptable. No one in this country should be treated that way. It's not fair. It's not right. And these circumstances could happen to any of us. This is one of those there but for the grace of God go I kind of situations. None of us are exempt, ever. So I think it's clear that health insurance reform and what it means for our families is very much a women's issue. It is very much a women's issue. And if we want to achieve true equality for women, if that is our goal, if we want to ensure that women have opportunities that they deserve, if that is our goal, if we want women to be able to care for their families and pursue things that they could never imagine, then we have to reform the system. We have to reform the system. The status quo is unacceptable. It is holding women and families back, and we know it. Fortunately, that is exactly what my husband's plan proposes to do.